I am Sarah Iqbal, and I work in the Howard University Department of Pediatrics. It is now time to do our first raffle, and this is for a $50 gift card. And our lucky winner is Ashley Batista. I'll repeat again, our lucky winner for our first raffle is Ashley Batista. And at this time, I would like to introduce Dr. Vicky Hoverman, the chair of our scientific committee. She will be presenting our scientific abstract winners. Welcome, Dr. Hoverman.
Thank you, Sahar. Hello, everyone. Welcome to the scientific abstract session for the 14th Annual International Conference on Stigma. We're glad to have you here. My name, as Sahar mentioned, is Vicky Hoverman, and I'm the chair of the conference's scientific committee. We're going to begin this afternoon by just announcing the Scientific Abstract Award winners. Afterwards, you'll hear a brief oral presentation from the best scientific abstract winner. So let's get started. The 12 posters presented on the conference portal were selected through a multi-round evaluation process by the scientific committee. From the fantastic research selected for this year's conference, the committee gave 3 awards. The third place scientific abstract award goes to Ms. Sylvia Valadez Tapia. Her research is entitled HIV Stigma Among Justice Involved and Non-Justice Involved Black, Psi, and Transgender Women Living with HIV or AIDS. The second place scientific abstract award goes to Dr. Abdallah Bey Dada and Mr. Tyson Hallman for their research entitled Stigma, Social Support, Perceived Stress, and Satisfaction with Life Among People Living with HIV in Oman. And lastly, the best scientific abstract award goes to Mr. Ikenna Nwakama. His research is entitled Mitigating Self-Stigma Among Adolescents and Young Persons Living with HIV Through a Peer Support System, Evidence from an Intervention in Nigeria. So I would like to congratulate all the award winners. You'll receive your prize either in person on Friday, November 17th, or in the mail after the conference. So next, I'm very excited to introduce the best scientific abstract award winner, Mr. Ikenna Nwakama. He's a public health professional with over 13 years of experience, largely in HIV response. Mr. Nwakama has a master's in public health from the French School of Public Health in Paris, France. He's published several papers in international journals and has been a featured speaker at several prestigious health conferences. Mr. Nwakama's professional journey has taken him to various organizations, most of which were faith-based, working to improve health and promote gender justice. Currently, he serves as a specialist for HIV prevention, care, and support at Caritas, Nigeria, where he continues to make a difference in lives of those infected and infected by HIV. One of Mr. Nwakama's most significant roles was his leadership of the Coalition of Civil Society Network on HIV and AIDS in Nigeria. In this position, he spearheaded advocacy programs aimed at ensuring the rights and meaningful involvement of individuals living with HIV and the most at-risk populations in the HIV response. So please give a warm welcome to Mr. Ikenna Nwakama.
Thank you, Vicky, for the introduction. Permit me to now share my slide. Please confirm you can see my slide.
Yes.
Thank you. Thank you again, Vicky, and thank you to everyone here. I'm so glad to be here again this year to share this knowledge and experience and also evidence from our implementations in Nigeria in the area of stigma mitigation, particularly for adolescents and young persons living with HIV. And this study, like introduced, is looking at the mitigation of self-stigma among adolescents and young persons living with HIV through a peer support system, evidence from our implementation in Nigeria. So okay. So as an introduction, we know that psychosocial issues surrounding HIV, stigma and status is a big problem in the continuum of care for persons living with HIV, particularly for the young persons. And that has always been a major trigger to stigma, particularly self-stigma amongst the population. And it has been established that social interventions play a major role in mitigating this stigma and these negative self-perceptions among persons living with HIV. And we know that understanding and addressing self-stigma among the young persons is very important in ensuring the optimal treatment outcomes, and also, of course, to ensure that the right mental health is achieved, to ensure that the young person's overall well-being is achieved in the treatment of HIV. And this study looked at the efficacy of an adolescent and young person's led intervention, social intervention, that aimed at addressing self-stigma amongst the young people and adolescents. The objective of the study is to assess the effect of that adolescents and young persons-led social intervention in mitigating HIV-related stigma, self-stigma among the young population living with HIV. And talking about the intervention, so the initiative, Adolescents Recreational Club, for short, ARC, was an initiative that was developed as a result of interactions and focus group discussions we had with the young persons. And we tried to assess initially what constituted youth-friendly services for them and what for them is the best way to address the basic needs of the young persons. And the major response we got was that the young persons naturally hit the idea of hospital or health medical intervention, and providing something different that wouldn't necessarily talk about Medicare or healthcare, or that will remind them of their status. We're very potent in addressing those mental health issues, those self-stigma issues. And that was what led to the introduction of this initiative. And the initiative in particular looked at, one, to make the adolescents and young persons active partners in the treatment of HIV in their own caregiving, and also to meet the psychosocial needs of that young population. The initiative was completely driven by the young persons, just a staff who acted as a cluster coordinator. Other than that, the initiative were all conceived and driven by the adolescents and young persons. And it all had 6 clusters in the States. Clusters, we had a hub and a scope model where in the cluster we had different facilities feeding into that cluster. And we had 6 clusters that implemented the ARC initiative in the state, and they all had their own activities, their own initiatives within the period monthly. And then once in a year, we had a statewide activity that brought all of them together for one interaction. Going further on the approach, so the clubs were supported to carry out different activities monthly. Like I said earlier, they had the freedom to develop what for them, what's suitable for them to meet their needs. Some chose either volunteering or other activities. And each club also, we had people given different roles. Some were given roles, coordinators of treatment literacy for the young persons. Some also were treatment support staff, peers for the young persons. The idea is that the young persons connect more with their peers. It's different from when an adult is talking to the young person about their treatment needs, about their needs as young persons. So using young persons who have stayed longer in the program, in the HIV program, to mentor the other ones has seemed to be more potent in ensuring that they understand their needs and also address those concerns and triggers of self-stigma. And the art clubs, of course, carried out activities in different forms, like I mentioned earlier. They adopted their own models, activities, and they are all supported to carry out those activities. And for this study, we followed this protocol, and so we had in all 313 persons included in the study, and 150 of them, that's about 48%, were from those in the art club. And we the art club. So we first collected data at baseline from the general AYP population, that's adolescents and young persons population in the different facilities, these services were provided. Then after 1 year, we also collected data again from both the intervention group. Now, intervention group are those that participated in the ARC activities, and then the control are those that did not participate, were not enrolled in the ARC activities. And of course, we collected data and analyzed the data using SPSS version 27 and did basic descriptive statistics and of course inferential statistics to look at the associations. And it all had these key outcomes of interest. One was disclosure of HIV status to a non-family member. Another one was willingness to talk about the HIV status. And then the other one was clinic appointment compliance, the rate at which they comply to appointment to clinics as a measure of continuity in care. And then we also had a general stigma scale using the Beja HIV stigma scale to assess the level of self-stigma among the different groups. And as a result, like I mentioned, so we had 313 enrolled and 16.8 was like the mean age, and amongst them, 59% were females. And from our analysis, there was a significant association between participating in the ARC activities and ability and willingness to disclose their status, and also willingness to talk about their status. Then also, the analysis showed that the ARC participation was significantly associated with clinic appointment compliance. And looking at the chart here, we also looked at the stigma scale, the degree to which likelihood of self-stigma among the population, comparing the baseline comparing the control and intervention group with the baseline data. So the scale at which we saw at baseline was 75%, 78% rather, likelihood of self-stigma. And then 1 year after, so we looked at among the intervention group, we saw a 42% likelihood, a drop. And then in the control group, we also saw a drop, but the difference between the intervention and control group was actually significant. So as a conclusion, so we saw that integrating these adolescent-friendly activities into HIV care showed efficacy in mitigating self-stigma amongst the young persons on treatment, on HIV treatment. And definitely we also acknowledge the potential limitations in the study, particularly potential selection bias, and also being that the feedback was self-reported, we also felt that there could have been, reports bias based on self-report responses. As recommendation, so we feel for further research, it will be very interesting to have a more robust cluster randomized trial to dig deeper, do a deeper dive on this model to see evidently the stronger evidence on how this model will make a significant difference in the lives of adolescents and young persons. And for program management, we also feel that it is logical, based on the data we have, to integrate social interventions into long-term care for adolescents and young persons as a way of promoting youth-friendly interventions in HIV care. That is a summary of the study. Thank you so much.
Thank you very much, Mr. Nwakma. That was wonderful. I just wanted to say a quick reminder that all of the scientific and community poster sessions will be held throughout the day tomorrow, Thursday, November 16th. So please review the schedule on the WOVA app to find out which posters will be presented at which times. We hope you can join us for a number of these sessions throughout the day and learn more about the presenters' fascinating research. And you can come and ask questions and have a great dialogue there. And then you can also access all the poster presentations on the conference portal prior to the sessions. Now I'm going to turn over this session to Ms. Patty Houston for the next activities.
Okay, I think we just have to unshare the other screen. Whoops. Okay. All right, good afternoon, everyone. If you didn't see me earlier, I'm Patty Houston from the Howard University Department of Pediatrics. And at this time, I would like to announce the winners for this year's ARC contest. Our submissions span many art forms, including drawings, paintings, collages, poetry, short stories, music, and videos. I've prepared a short slide presentation, so I'm going to pull that up. And then after that, I have a couple more announcements. Okay, it's still saying that another participant is sharing.
Go ahead and give it another try.
Oh, okay,
Patty.
here we go. Yeah, I got it now. Okay, so our winners, let's see. Okay, so our third prize was Resilience Journey from Darkness to Love, which was a poem by Kajumba McQuillan. And he was from Uganda. So we actually have, if you go under resources in Whova, there's a document section. So in there, we have all the written submissions from this year so that you can read this poem as well as our other written submissions. So congratulations on that poem. Second prize was painting I Lost My Mind. Whoops, sorry. Oh gosh. For some reason I went back to the beginning. Okay, so this person I can share, was from the Philippines, but they have chosen to remain anonymous with this artwork. So we're gonna congratulate them, and we will find a way to get their prize to them. There was I think part of the reason this painting won was there was a nice explanation with it, kind of a story behind it. Okay, my slides are not moving. Okay. And first prize, this was a video submitted entitled Here We Are, Voices of Black Women Who Live with HIV. So this video, we're actually going to play it right in a few minutes right now, right at the beginning of lunch. We're going to have that playing so that you can see it, and we will play it again Friday at the beginning of the Friday lunch. We're in person. So congratulations, first prize. Okay, then we did select 4 additional honorable mentions. So they were a short story called Stigma Taught Me About Life by Santi Saifat. She's from Indonesia. So again, you'll find this story on the Whova site under documents. Not Alone, which was a dance piece by Born Talented Achievers from Uganda. Many of you have seen their work in previous years. They've won before. I think they even won first place one year in our contest. So that video is going to play after the Black women's video. There's going to be a video during lunch, which will include this performance. This painting was an celebration of us through Stigma by Ty Tover. And then lastly, Misunderstood by Luther Wright. So congratulations to all our winners. In addition, there will be, along with the video at lunch where you see the dance, there's going to be a slideshow of art too, which is going to include, sorry, I'm trying to stop sharing. It's going to include all of the visual art submissions so that you can see those. So let me just give a couple other announcements. This afternoon, the way it's going to work is we have 3 different time slots of workshops. So in each of the 3 sessions, you'll have a choice between 2 different workshops. So please, during lunch, if you haven't already, review the afternoon schedule so that you know which workshop you're going to head into at that time. So our content goes till 5:45 with those workshops, at which point We do have one of our poster presentations going at 6 o'clock. And after that, we have our 7 o'clock movie, which is about, I think, a 35-minute documentary, so not too long. And then there'll be a brief panel after that movie. So I just want to remind you also to fill out your session evaluations with every session that you watch. You can click on rate session and give us a little evaluation. So I want to turn it over now to Joanne Adelberg, who's going to give you just a little more detail about those poster presentations that you keep hearing about. Joanne?
Hey there, how are you? Thank you, Patty, for introducing me. I'm Joanne Adelberg. I am a family advocate and genetic counselor here at Howard University. I'm also on the scientific committee, so I had a chance to review the posters, and they were all very good. So I hope that you can take the time to take a look at them. If you go to the agenda and under poster presentations, there are the pre-recorded posters that are there. The pre-recorded posters did not have a live presentation. So if you were able to view some of the live presentations yesterday, and there is another one at 6 o'clock this evening, and there will be more tomorrow, as well as on Friday, some of the poster presenters will actually be at the conference, which is very nice. If you can, those who are coming in person can come and take a look at the posters on the day of the conference. That would be great. And let me see if there's anything else. Yeah, if you have any issues in regards to accessing the information, it's on the Whova app. And when you go on Whova, look at agenda, and then you'll see the posters there. The live presentations is actually part of the agenda, so that will show up daily, but you can also access it looking at posters as well. So that is pretty much all for posters. If you do have any questions, just message me, let me know. And we are moving on to the second raffle with Abina Ben, and she is going to do the next one.
Hey, hi everyone. I'm Abina Ben. I'm a senior Howard University student working in the Department of Pediatrics at Howard University. It is now time to do our second raffle, and this will be for a $50 Visa gift card. And the winner is Rebecca Green.
Okay, so now we're going to go over to lunch. So Lasan is going to play that video, and then we're going to have the other videos. So grab some food and, check out the videos we have streaming or other parts of our site. And then make sure you get back on early for the afternoon workshops, which will start at 1:45. Thank you, everyone.